The Subtalar Joint Axis Locator by Kevin Kirby. The Subtalar Joint Axis Locator is a device that Dr. Simon Spooner and I designed and developed in 2005. We then had a radiographic research study published using the Subtalar Joint Axis Locator in the May-June 2006 issue of the Journal of the American Podiatric Medical Association describing its use. The Subtalar Joint Axis Locator allows a researcher and clinician to accurately assess the spatial location of the subtalar joint axis during both weight-bearing and non-weight-bearing function of the foot. In order to use the Subtalar Joint Axis Locator, the anterior and posterior exit points of the subtalar joint axis must first be determined. Here we see with the subject supine, I am marking a grid overlying the dorsal neck of the talus where the anterior exit point of the subtalar joint axis is nearly always located. Once the grid has been completed, then with the fourth and fifth metatarsal heads dorsiflexed with approximately 5 pounds of manual force to load both the Achilles tendon and foot and ankle joints, the subtalar joint is rotated into both pronation and supination by placing a medially directed and laterally directed force on the forefoot. The examiner should then place their eyes in line with the approximate spatial location of the subtalar joint axis and, while moving the subtalar joint, assess which of the grid points moves the least during subtalar joint range of motion. Here I have just marked the point on the skin of the anterior talar neck, which initially seems to be moving the least and which closely approximate the subtalar joint axis anterior exit point. Here I am remarking that point on the anterior talus to better approximate the subtalar joint axis anterior exit point. Next, the subject is placed in a prone position so that the same type of grid may now be marked on the posterior superior lateral corner of the calcaneus, where the subtalar joint axis nearly always exits from the posterior aspect of the foot. The grid is drawn on the foot, the subtalar joint axis is placed through its range of motion with the examiner's eyes placed in line with the spatial location of the subtalar joint axis, and the point which seems to rotate the least is then marked, which will closely approximate the subtalar joint axis posterior exit point. The subtalar joint axis locator consists of a lateral and medial suction cup that will be clamped to the calcaneus, 2 bolts that are threaded through the locator's plastic brackets that can be adjusted to tighten the cups on the calcaneus, the posterior and anterior pointers, and lastly, the pointer frame that allows the 2 pointers to maintain a straight line relationship to each other so that the pointers will point toward each other through the foot along the subtalar joint axis during subtalar joint range of motion. To place the subtalar joint axis locator on the foot, the suction cups are positioned on the medial and lateral aspects of the calcaneal body, and the locator is positioned so that the posterior pointer of the device may be directed at the posterior exit point on the posterior lateral calcaneus. The bolts are then tightened to secure the device to the calcaneus, being careful not to over-tighten and injure the subject. The adjusting screws on the swivel joints are then all loosened and then are retightened so that both the posterior and anterior pointers of the subtalar joint axis locator are aligned with the posterior and anterior exit points of the subtalar joint axis on the foot. Here we see some final readjustments of the swivel joints so that the posterior pointer is aligned well with the posterior exit point on the posterior lateral superior calcaneus. Now, when rotating the subtalar joint again into pronation and supination, we can see the subtalar joint axis locator moving with the foot. Note how closely the anterior pointer of the device, which is not attached to the talus, but rather is only attached to the calcaneus, tracks the anterior exit mark on the dorsal aspect of the talar neck. This close tracking of the talar neck was also shown to be present in the radiographic study that Dr. Spooner and I had published in the Journal of the American Podiatric Medical Association in 2006. Here the close tracking of the anterior pointer relative to the anterior exit point of the subtalar joint axis is seen during both plantar flexion and dorsiflexion motions of the ankle joint, indicating that ankle joint motion will not likely interfere with the accuracy or the ability of the subtalar joint axis locator to track the subtalar joint axis. In the non-weight bearing setting, it is clearly evident that the subtalar joint axis locator spins on the axis of the pointers during subtalar joint movement, which seems to indicate a very close approximation of the subtalar joint axis locator to the subtalar joint axis during subtalar joint pronation and supination range of motion. During weight-bearing motion of the subtalar joint with the subtalar joint axis locator in place, we can again see how closely the subtalar joint axis locator tracks the anterior exit point of the subtalar joint axis. During closed kinetic chain pronation motion, it is seen that the subtalar joint axis internally rotates relative to the plantar foot and to the ground, and during closed kinetic chain supination motion, the subtalar joint axis is seen to externally rotate relative to the plantar foot and to the ground. The close tracking of the anterior pointer relative to the anterior exit points of the subtalar joint axis on the dorsal talar neck is an indication of how close the subtalar joint axis locator can track the subtalar joint axis. On the lateral view of the foot, the subtalar joint axis locator is shown to stay at relatively the same inclination angle in this subject. In other words, the inclination angle of the subtalar joint axis seems to change very little in pronation and supination motions in this foot. On the posterior view, the subtalar joint axis locator is shown to move with the calcaneus during both supination and pronation motions of the subtalar joint. The subtalar joint axis locator is a relatively simple device that allows relatively accurate tracking of the subtalar joint axis, a joint axis that is not only very important to foot function, but also is a joint axis that has only been able to be tracked up until this time by using bone pins or bone markers drilled into both the talus and calcaneus. It is hoped that this video simplifies the use and biomechanical function of the subtalar joint axis locator, so that further experimental work will confirm the important biomechanical significance of subtalar joint axis spatial location on the kinetics of the foot and lower extremity during weight-bearing activities.